After making a medical diagnosis, a healthcare provider will choose interventions and communicate the plan to the healthcare team. After identifying a patient's nursing diagnosis and collaborative problems, the nurse prioritizes the diagnoses, sets patient-centered goals and expected outcomes, and chooses nursing interventions appropriate for each diagnosis. The plan of care should be individualized. This requires communicating closely with patients, their families, and the healthcare team, and ongoing consultation with team members. The nursing diagnosis that you identify directs your selection of individualized nursing interventions, and the goals and outcomes you hope to achieve. A plan of care is dynamic, and changes as the patient's needs change. Establishing priorities. Priorities help you to anticipate and sequence nursing interventions when a patient has multiple nursing diagnoses and collaborative problems. Ordering of nursing diagnoses or patient problems uses determinations of urgency and/or importance to establish a preferential order for nursing interventions. You must establish priorities in relation to their ongoing clinical importance. One way to consider nursing diagnoses of high priority is to consider Maslow's hierarchy of needs. It is always important to consider each patient's unique situation. Avoid classifying only physiological nursing diagnoses as high priority. Nursing diagnoses that, if untreated, results in harm to a patient or others should be priority. For example, those related to airway status, circulation, safety, and pain will have the highest priorities. Intermediate priority nursing diagnoses involve non-emergent, non-life-threatening needs of patients. Low-priority nursing diagnoses are not always directly related to a specific illness or prognosis, but affect a patient's future well-being. The order of priorities changes as a patient's condition and needs change, sometimes within a matter of minutes. Each time you begin a sequence of care, such as at the beginning of a hospital shift or during a clinic visit, it is important to reorder priorities. The appropriate ordering of priorities ensures that you meet a patient's needs in a safe, timely, and effective way. Priority setting begins when you identify and prioritize a patient's main diagnosis or problems. The next step is to prioritize the specific nursing interventions that you plan to use to help a patient achieve desired goals and outcomes. Involve patients in priority setting whenever possible. Always assign priorities on the basis of good nursing judgment. When ethical issues make priorities less clear, it is important to have an open discussion with the patient, the family, and other healthcare providers. Many factors within the healthcare environment affect your ability to set priorities. The same factors that influence your minute-by-minute ability to prioritize nursing actions affect your ability to prioritize nursing diagnoses for groups of patients. The nature of nursing work challenges your ability to cognitively attend to a given patient's priorities when you care for more than one patient. Always work from your plan of care and use your patient's priorities to organize the order for delivering interventions and documenting care, shown as Figure 18.1, a model for priority setting. Case study. Falmala is a first-semester nursing student who is assigned to Ms. Nadine Skyfall, a 35-year-old American Indian patient, diagnosed with severe anemia secondary to a bleeding peptic ulcer. Ms. Skyfall experiences pain because of the ulcer, and weakness and fatigue, resulting from the anemia. Falmala develops Ms. Skyfall's plan of care, which addresses pain, weakness, fatigue, nutrition, and patient safety. Question: why do you think anemia and peptic ulcer are not part of the care plan? The reason anemia and peptic ulcer is not part of Formula's care plan is because nursing care plans do not directly address the medical diagnosis. Critical thinking in setting goals and expected outcomes. A goal is a broad statement that describes the desired change in a patient's condition, perceptions, or behavior. It is also known as an aim, intent, or end. Expected outcomes are measurable changes that must be achieved to reach a goal. Many times, several must be met to meet a single goal. Planning nursing care requires you to critically evaluate the identified nursing diagnosis, the urgency or priority of the problems, and the resources of the patient and the healthcare delivery system. Apply knowledge from the medical, socio-behavioral, and nursing sciences to plan patient care. The selection of goals, expected outcomes, and interventions requires consideration of your previous experience with similar patient problems and any established standards for clinical problem management. The goals and outcomes need to meet established intellectual standards by being relevant to patient needs, specific, singular, observable, measurable, and time-limited. You also use critical thinking attitudes in selecting interventions with the greatest likelihood of success. Please review Table 18.1, Examples of Goal Setting with Expected Outcomes for Mr. Lawson, as a supplement to this PowerPoint. The nursing process includes assessment, diagnosis, planning, implementation, and evaluation. Additionally, knowledge, experience, attitudes and standards are all part of the nursing process, shown as Figure 18.2. Critical thinking and the process of planning care. Students should familiarize themselves with this model. Role of the patient in goal outcome setting. For patients to participate in goal setting, they need to be alert and have some degree of independence in completing activities of daily living, problem solving, and decision making. They also need to understand the priority problems and have a willingness and motivation to resolve those problems. Unless goals are mutually set, and there is a clear plan of action, patients may not fully participate in the plan of care, leading to suboptimal outcomes. Patients need to understand and see the value of nursing therapies, even though they are often totally dependent on you as the nurse. When setting goals, act as an advocate or support for the patient to select nursing interventions that promote his or her return to health or prevent further deterioration when possible. A patient-centered goal is aimed at the patient's highest possible level of wellness and independence in function, based on patient needs, abilities, and resources. A patient-centered goal or outcome also reflects a patient's specific behavior, not your own goals or interventions. It is important to select and measure patient outcomes that are influenced by nursing care. A patient goal represents predicted resolution of a diagnosis or problem, evidence of progress toward resolution, progress toward improved health status, or continued maintenance of good health or function. For the nursing profession to become a full participant in clinical evaluation research, policy development, and interdisciplinary work, nurses need to identify and measure patient outcomes influenced by nursing interventions. Nursing Outcomes Classification, NOC, is a resource that can be used in selecting goals and outcomes for your patients. For each NANDA nursing diagnosis, there are multiple nursing outcome classification suggested outcomes. The outcomes have labels for describing the focus of nursing care and include indicators or expected outcomes to use in evaluating the success with nursing interventions. The indicators for each NOC outcome allow measurement of the outcomes at any point. Using standardized nursing terminology such as NOC makes it more possible to measure aspects of nursing care on a national and international level. Please review Table 18-2. Examples of NANDA International Nursing Diagnoses and Suggested NOC linkages, as a supplement to this PowerPoint. Writing goals and expected outcomes. A goal should be patient-centered. Each goal and outcome should address only one behavior, perception, or physiological response. Expected outcomes must also be singular. Specificity allows you to decide if there is a need to modify the plan of care. Use the SMART acronym for goal setting, which stands for specific, measurable, attainable, realistic and timed. Nurses need to be able to measure or observe if change takes place in a patient's status. Terms describing quality, quantity, frequency, length, or weight allow you to evaluate outcomes precisely. For a patient's health to improve, he or she must be able to attain the outcomes of care that are set. A goal and an outcome likely are attainable when mutually set with the patient. If mutually set, it increases the patient's motivation and cooperation. Your knowledge background helps to select goals and outcomes that should be met on the basis of typical responses to clinical interventions. Set goals and expected outcomes that a patient is able to realistically reach. Realistic goals give patients a sense of hope. Be aware of the patient's physiological, emotional, cognitive, and sociocultural potential and the economic cost and resources available. Each goal and outcome is time-limited, so the healthcare team has a common time frame for problem resolution. A short-term goal is an objective behavior or response that you expect a patient to achieve in a short time, usually less than a week. In an acute care setting, you often set goals for over a course of just a few hours. A long-term goal is an objective behavior or response that you expect a patient to achieve over a longer period, usually over several days, weeks, or months. Time frames help you and the patient determine if the patient is making progress at a reasonable rate. If not, you must revise the plan of care. Time frames also promote accountability in delivering and managing nursing care. Time for a quick quiz. A patient is suffering from shortness of breath. The correct goal statement would be written as A. The patient will be comfortable by the morning. B. The patient will breathe unlabored at 14 to 18 breaths per minute by the end of the shift. C. The patient will not complain of breathing problems within the next 8 hours. Or D. The patient will have a respiratory rate of 14 to 18 breaths per minute. The answer is B, as it addresses all components of a goal. Critical thinking in planning nursing care. Nursing interventions are treatments or actions based on clinical judgment and knowledge that nurses perform to enhance patient outcomes. Part of the planning process is to select nursing interventions to meet the patient's goals and outcomes. Once nursing diagnoses have been identified, and goals and outcomes selected, you choose interventions individualized for the patient's situation. During planning, you select interventions designed to help a patient move from the present level of health to the level described in the goal and measured by the expected outcomes. Choosing suitable nursing interventions involves applying the best evidence for a patient's health problems and using good clinical judgment. Actual implementation of these interventions occurs during the implementation phase of the nursing process. Nurses need to be able to do the following: know the scientific rationale for the intervention, possess the necessary psychomotor and interpersonal skills, and be able to function within a setting to use healthcare resources effectively. Types of interventions. Nurse-initiated interventions require no order, and no supervision or direction from others. Nurse-initiated interventions are autonomous actions based on scientific rationale. Such interventions benefit a patient in a predicted way related to nursing diagnosis and patient goals according to the Nurse Practice Acts. In a majority of states, independent nursing interventions pertain to activities of daily living, health education and promotion, and counseling. Some examples of nurse-initiated interventions include elevating an extremity and providing patient education. Healthcare provider-initiated interventions require specific nursing responsibilities and technical nursing knowledge. These interventions are based on the healthcare provider's response to treat or manage a medical diagnosis. Each of these interventions requires nursing responsibilities and technical nursing knowledge. Advanced practice nurses who work under collaborative agreements with physicians, or who are licensed independently by state practice acts, are able to write dependent interventions. Typically, when you plan care for a patient, you review the necessary interventions and determine whether the collaboration of other healthcare disciplines is necessary. In a patient care conference, the multidisciplinary healthcare team selects and assigns interdependent nursing interventions. Every nurse has encountered an inappropriate, or incorrectly written, order. Therefore, when preparing for physician-initiated or collaborative interventions, do not automatically implement the therapy, but determine whether it is appropriate for the patient. The ability to recognize incorrect therapies is particularly important when administering medications or implementing procedures. Clarifying an order is part of competent nursing practice, and it protects the patient and members of the healthcare team. When you carry out an incorrect or inappropriate intervention, it is as much your error as the person who wrote or transcribed the original order. You are legally responsible for any complications resulting from the error. Case study continued. Falmela develops Ms. Skyfall's plan of care, including writing the goals and expected outcomes. Falmela knows that the guidelines for writing goals and expected outcomes include that they be measurable, time-limited, observable, and realistic. Question: what are the 7 guidelines for writing goals and expected outcomes? The 7 guidelines for writing goals and expected outcomes are patient-centered. Singular goals or outcomes. They are observable, specific, measurable, and time-limited with mutual factors, and they are realistic. Selection of interventions. 6 factors to consider. 1. Desired patient outcomes. 2. Characteristics of the nursing diagnosis. 3. Research-based knowledge for the intervention. 4. Feasibility of the intervention. 5. Acceptability to the patient. And 6. Nurse's competency. When selecting interventions, review the patient's needs, priorities, and previous health experiences. Correctly written nursing interventions include actions, frequency, quantity, method, and the person to perform them. Please review Box 18.1, Choosing Nursing Interventions, as a supplement to this PowerPoint. The Iowa Intervention Project developed a set of nursing interventions that provides a level of standardization to enhance communication of nursing care across healthcare settings, and to compare outcomes. The Nursing Interventions Classification, or NIC, is a comprehensive, research-based, standardized classification of interventions that nurses perform. The NIC model includes 3 levels: domains, classes, and interventions. NIC interventions are linked with NANDA International Nursing Diagnosis. The 7 domains are the highest level, Level 1, of the model, and broad terms are used to organize the more specific classes and interventions. The second level of the model includes 30 classes, which offer useful clinical categories. The third level of the model includes 554 interventions, defined as any treatment based on clinical judgment and knowledge that a nurse performs to enhance patient outcomes. Each intervention includes a variety of nursing activities from which to choose and which a nurse commonly uses in a plan of care. You determine which interventions and activities best suit your patient's individualized needs and situation. Please review Table 18.3, Nursing Interventions Classification Taxonomy, N. Boxes 18.2 and 18.3. Example of interventions for physical comfort promotion and example of an intervention and associated nursing activities, as a supplement to this PowerPoint. Case study continued. Formula knows that blank interventions require an order from a physician or another healthcare professional. The answer is dependent. Dependent nursing interventions are actions that require an order from a physician or other healthcare professional. System for planning nursing care. Nursing care plan equals nursing diagnosis, goals and expected outcomes, nursing interventions, and a section for evaluation findings so any nurse is able to quickly identify a patient's clinical needs and situation. Care plans also reduces the risk for incomplete, incorrect, or inaccurate care. The care plan changes as the patient's problems and status change. The plan gives all nurses a central document that outlines a patient's diagnosis and problems, the plan of care for each diagnosis and problem, and the outcomes for monitoring and evaluating patient progress. The interdisciplinary plan focuses on patient priorities and improves the coordination of all patient therapies and communication among all disciplines. A nursing care plan is a guideline for coordinating nursing care, promoting continuity of care, and listing outcome criteria to be used later in evaluation. The nursing care plan enhances the continuity of nursing care by listing specific nursing interventions needed to achieve the goals of care. A care plan includes a patient's short and long-term goals and outcomes, making it an important part of discharge planning. Thus, it is beneficial to involve the family in planning care if the patient is agreeable. Handoff reporting. During a nursing handoff, nurses collaborate and share important information that ensures the continuity of care for a patient and prevents errors or delays in providing nursing interventions. Recent research identifies approaches to use for effective handoffs and barriers to their effectiveness. In some agencies, the nursing handoff process occurs during walking rounds when nurses exchange information about patients at the bedside, giving patients the opportunity to also ask questions and confirm information. Written care plans organize information exchanged by nurses in handoff reports. You learn to focus your reports on the nursing care and treatments completed, patient responses, and expected outcomes documented in the care plans. Please review Box 18.4, Evidence-Based Practice, Nursing Handoff Reports, as a supplement to this PowerPoint. Student care plans. Student care plans are useful for learning the problem-solving technique, the nursing process, skills of written communication, and organizational skills needed for nursing care. A student care plan helps you apply knowledge gained from the nursing and medical literature and the classroom to a practice situation. Student care plans are more elaborate than the care plan used in a hospital or community agency, because its purpose is to teach the process of planning care. Most commonly, a column format is used. A 5-column format includes 1. Assessment data relevant to corresponding diagnosis. 2. Goals outcomes identified for the patient. 3. Implementation of the plan of care. This is where you would select interventions appropriate for the patient. 4. A scientific rationale, which is the reason that you chose a specific nursing action based on supporting evidence. And last, 5. A section to evaluate your care. The following questions help you design a plan. What is the intervention? And is it evidence-based? When should each intervention be implemented? How should the intervention be performed for this specific patient? And who should be involved in each aspect of intervention? Each scientific rationale that you use to support a nursing intervention needs to include a reference, whenever possible, to document the source from the scientific literature. It is important that each intervention be specific and unique to a patient's situation. Common omissions that nurses make in writing nursing interventions include action, frequency, quantity, method, or person to perform them. For care plans in community-based settings, you design a plan to 1. Educate the patient and family about necessary care techniques and precautions. 2. Teach the patient and family how to integrate care within family activities. And 3. Guide the patient and family on how to assume a greater percentage of care over time. Finally, the plan would include the nurses and the patients and families' evaluation of expected outcomes. This diagram is an example of a student care plan. Critical pathways. Care plans and critical pathways increase communication among nurses, facilitates the continuity of care from one nurse to another, and from one healthcare setting to another. A critical pathway clearly defines transition points in patient progress, and draws a coordinated map of activities by which the healthcare team can help to make these transitions as efficiently as possible. Critical pathways improve continuity of care, because they clearly define the responsibility of each healthcare discipline. Well-developed pathways include evidence-based interventions and therapies. The main purpose of critical pathways is to deliver timely care at each phase of the care process for a specific type of patient. Concept maps. Research shows that use of concept maps help nursing students make better clinical decisions and develop better clinical judgment skills. When planning care for each nursing diagnosis, analyze the relationships among the diagnoses. Draw dotted lines between nursing diagnoses to indicate their relationship to one another. Because you care for patients who present with multiple health problems and related nursing diagnoses, it is often not realistic to have a written columnar plan developed for each nursing diagnosis. It is important for you to make meaningful associations between one concept and another. The links need to be accurate, meaningful, and complete so you can explain why nursing diagnoses are related. Finally, on a separate sheet of paper, or on the map itself, list nursing interventions to attain the measurable outcomes for each nursing diagnosis. This step corresponds to the planning phase of the nursing process. While caring for the patient, use the map to write his or her responses to each nursing activity. Also write your clinical impressions and inferences regarding the patient's progress toward expected outcomes and the effectiveness of interventions. Critical thinkers learn by organizing and relating cognitive concepts. Please review Figure 18.3, Concept Map for Mr. Lawson, Planning, as a supplement to this PowerPoint. This diagram is an example of a concept map. Falmala writes down several independent nursing interventions that she is developing for Ms. Skyfall. What are some examples of independent nursing interventions that Falmala may develop for Ms. Skyfall? Independent nursing interventions do not require an order from another healthcare professional. Examples of independent nursing interventions include patient positioning and education. Time for a quick quiz. When caring for a patient who has multiple health problems and related medical diagnoses, nurses can best perform nursing diagnoses and nursing interventions by developing a critical pathway, b nursing care plan, c concept map, or d diagnostic label. The answer is C. Concept maps help the nurse organize nursing interventions for a patient with multiple problems. Consulting with other healthcare professionals. Consulting is a process by which you seek the expertise of a specialist such as your nursing instructor, a physician, or a clinical nurse educator, to identify ways to handle problems in patient management, or in planning and implementation of therapies. Consultation can occur at any step of the nursing process. Consultation increases your knowledge about a patient's problem, and helps in learning skills, and obtaining the resources needed to solve the problem. When making a consultation, first identify the general problem, direct the consultation to the right professional, and provide the consultant with relevant information about the problem. Various healthcare professionals to consult in the hospital include dietitians, respiratory therapists, physical therapists, wound care specialists, diabetic educators, and case managers. Do not be afraid to ask for a consultation. Consultations will increase your knowledge, and will help you learn new skills, and how to obtain additional resources. You consult most often during planning and implementation. During these times, you are more likely to identify a problem requiring additional knowledge, skills, or resources. This requires you to be aware of your strengths and limitations as a team member. The consultation process is important, so all healthcare providers are focused on common patient goals. Always be prepared before you request a consult. Consultation is based on the problem-solving approach, and the consultant is the stimulus for change. In clinical nursing, consultation helps to solve problems in delivery of nursing care. Nurses are consulted for their clinical expertise, patient education skills, or staff education skills. Nurses also consult with other members of the healthcare team such as physical therapists, nutritionists, and social workers. Again, the consultation focuses on problems in providing nursing care. Consultation occurs when you identify a problem that you are unable to solve using personal knowledge, skills, and resources. The process requires good intrapersonal and interprofessional collaboration. Consultation with other care providers increases your knowledge about the patient's problems, and helps you learn skills and obtain resources. An objective consultant enters a clinical situation, and more clearly assesses and identifies the nature of a problem, whether it is patient, personnel, or equipment-oriented. Most often you consult with healthcare providers who are working in your clinical area. However, sometimes you consult over the telephone. The first step in making a consultation is to assess the situation and identify the general problem area. Second, direct the consultation to the right professional, such as another nurse or social worker. Third, provide a consultant with relevant information about the problem area, and seek a solution. Include a brief summary of the problem, methods used to resolve the problem so far, and outcomes of these methods. Also, share information from the patient's medical record, conversations with other nurses, and the patient's family. Fourth, do not prejudice or influence consultants. Consultants are in the clinical setting to help identify and resolve a nursing problem, and biasing or prejudicing them blocks problem resolution. Avoid bias by not overloading consultants with subjective and emotional conclusions about the patient and the problem. Fifth, be available to discuss a consultant's findings and recommendations. Provide a private, comfortable atmosphere for the consultant and patient to meet. A common mistake is turning the whole problem over to the consultant. The consultant is not there to take over the problem, but to help you resolve it. When possible, request a consultation for a time when both you and the consultant are able to discuss the patient's situation with minimal interruptions or distractions. Finally, incorporate the consultant's recommendations into the care plan. The success of the advice depends on the implementation of the problem-solving techniques. Always give the consultant feedback regarding the outcome of the recommendations. Please review Box 18.5, Tips for Making Phone Consultations, as a supplement to this PowerPoint. Case study continued. Fumula's clinical coordinator tells her to coordinate with a nutritionist to develop a meal plan for Ms. Skyfall. Would Fumula's working with a nutritionist be considered a collaborative intervention? The answer is yes. Collaborative interventions, or interdependent interventions, are therapies that require the combined knowledge, skill, and expertise of multiple healthcare professionals. Time for a quick quiz. Consultation occurs most often during which phase of the nursing process? A. Assessment. B. Diagnosis. C. Planning. Or D. Evaluation. The answer is C. The planning phase. When a nurse is unsure of how to proceed in the planning process, he or she will seek out another colleague's knowledge and experience to assist in planning interventions for the patient.